This segment of The Exchange on My West Michigan is sponsored by iChiro Clinics. We've all probably heard of arthritis, but did you know there are more than 100 different forms of that joint disorder? The most common is degenerative arthritis, also known as osteoarthritis, and it can really impact your quality of life. Dr. Michael Kwast is here from iChiro Clinics to talk about dealing with degenerative arthritis. Good morning. Good to see you.
You too. Thank you.
What is this, osteoarthritis or degenerative arthritis?
Well, most people, when you talk about that, they believe that their joints just wear out because of one thing called age. I see patient after patient, they come in, they have degenerative arthritis, and I ask them, I say, well, how did you get that? And they say, I'm old.
I'm just older, yeah.
Right.
But isn't there some truth to that?
There is some truth to that, but what really, if you really want to look at that, then if that was the case, then every joint in your body, from your little toe joint all the way up to your neck, and everything would all be worn out exactly the same because your joints are all the same age, and you don't ever see that. So we know that it's not just age. So what it is actually muscle compression on a joint over time. So if you have a joint that all the deep muscles are compressing and wearing and tearing in that, that will cause that bone to deform. Medically, it's called Wolfe's Law. And it means that when there's pressure put on bones, they will change and malform, which turns them into these degenerative joints.
Yes, which can be quite painful.
Very painful, can be debilitating. People can have all sorts of horrible quality of life issues. And the sad part is a lot of it is possibly preventable if you can act early when we find a range of motion restriction. So meaning that your joint isn't moving very well because there's muscles around it that are tight. May not even be hurting, but if it's tight, you can be sure that the compressive forces on the joint, on the cartilage, are going to be higher than if that was less.
Describe that a little more, Dr. Kwast. So when you say tight, like maybe I can't use my arm in the way that I traditionally have, or what is it? I don't know what a tight joint might be like.
Usually that's what you see. So like when someone comes in, we test all the joint motions so you can see. So even like turning your head, you should be able to turn your head a nice, easy 90 degrees. And we'll see patients who turn their head about 45 degrees, but because it doesn't hurt yet, they think that everything's fine, you know, and there's not a problem. But really what that shows, that lack of mobility, shows that there is stress and tension coming from the deep muscles in the joint. If we can get into those muscles, get them to relax and let go, you can restore the motion, and then you reduce the chance of having a problem.
And this is an intervention that you do, and the earlier, I'm guessing, the better, so that you're not causing that compression to happen over time.
Yeah, exactly. And this is what people don't know. Everybody tells me, oh, chiropractor, you're about bones. No, you're wrong. It's actually about the muscles that hold the bones in the alignment that they're in, and then how they impact all of the tissues that those muscles can then compress and change. So the treatments, the adjustments that chiropractors do, all facilitate into the muscle and make the muscle relax and open up. And then that's how you can change that and actually have a higher quality of life so that you can do more things, you know, as you age. You don't want to be an old person living in a nursing home. You want to be an old person taking grandkids out. You want to be doing the things that you want to do, golfing. It's so sad. I see patients regularly who, you know, thought they were going to retire and golf every day, and the guy is in such a mess because he hasn't taken care of himself. There's can't golf at all.
No golf on the docket.
Not at all.
If you would like to see Dr. Kwast to talk about your own situation, we have put his contact information on our website. It's at wzzm13.com under The Exchange.